They have their own reasons for being difficult.
We talk about KPJ, it is beyond care.
This is where, help listening to them.
It's about patient journey.
We talk about life.
Listen, and listen.
Terus belajar dan belajar.
Patient journey is not only about the treatment, it's also about their experience.
It speaks for one thing.
The key word here is to adjust. Adjust and try and go with the flow.
And not just to live longer.
JCorp has the visions of Membina dan Membela. So this is how we essentially give back to the community.
When we talk about KPJ, it is beyond care. It's all about goal. It speaks for one thing. The gold standard that we're going to deliver in what we do to all our stakeholders.
Care for Life has been KPJ's tagline for a while now.
The word care for life also is a very big word. We talk about life. Life is actually from the womb to the tomb.
Or we could look at it from the aspect of the breadth and the depth of life. So imagine a Malaysian not being able to taste their nasi lemak or smell their durians, right? So I'm an ENT surgeon. We look at smell disorders. We treat conditions where that affects smell, and so these are the things that we sometimes forget, that we are there to serve in terms of being able to restore the experience of life and not just to live longer.
Care for life in the scene. Kita care bukan sahaja kepada pesakit untuk rawatan penyakit dia, tetapi juga the whole. The whole termasuklah family dan juga visitors dia.
The first letter C is a commitment. Yeah? We are committed to deliver the best care, gold standard to all our stakeholders. The second is about accountability. Accountable meaning that each and everyone in the organization is accountable to what they do daily in, daily out. Yeah. R, respectful. Yeah. We have to respect the diversity with dignity and courtesy. And more importantly, excellent. Delivering the best care at all time, regardless of who are they, where are they, and how are they. That will be our main aim.
I have Care for Life as a pedoman, but is that the North Star for me? I think this is actually where myself have been working very, very closely with my leadership team. And we ask ourselves, and we sit down as a workshop, right, as a group, we brainstorm. We ask ourselves, how do we look at Care for Life? What does that mean and the value create to all the key stakeholders? And we're looking at these 5 key stakeholders. Who are the 5 P? Our patients. And who give service to our patient is our physicians. And who support physicians is our people. And who actually is our partners in the entire ecosystem. And the partners here is not only about insurance and TP and all, it's also policymakers. They are also our partners. And ultimately, we are all here in this bigger so-called context of a planet.
These are the 5 strategic partners that we need to take care in ensuring that we can give the best care to them in terms of business decision, in terms of return, and most importantly, in terms of clinical outcome.
they always believe in their people, internal people. They groom their people, they give the proper training, so that you can elevate yourself. Then everyone have their punya career path. But again, the choice is ourselves. Where you want to put yourself in the next few years. The choice is on us.
Kita ada hantar staff kita untuk pergi contohnya intensive care, OT, NICU, neonat, pediatric, orthopedic, oncology, emergency, dialysis. So setiap specialized unit tu kita ada post basic untuk enhance staffnya knowledge and skill, dapat memberikan rawatan dan perkhidmatan yang lebih excellent kepada pesakit.
But this is a hospital where it's cared for us. Career growth is immense. It's whether you want to do it or you don't. Loans are given, scholarships are given, So there came a time when they even they remove your bonds just because they want you to excel and all that. So I just want you to share.
When I first was, kind of enticed to join KPJ University, I was tasked to set up a medical school. But I told the management of KPJ at the time, what I can do and I tried is do a medical specialist training program. And then got everybody, what can we do? A specialist training when we don't have a medical school. And I started to give ideas and how can be done, how we need to be innovative in the training of doctors to become specialists and all that. And then the management decided, this is something that they love to do.
Knowing that KPJ being the largest network hospital in the country and being a homegrown brand, right? I think there's a lot of pride with our team for the past close to about 43 years, since 1981. But of course, over years, many things happens, right? I think it's about high time after 40 over years for us to relook into ourselves and saying that how do we best serving our Malaysian on top of international patients, as we have actually choose to optimize our resources.
We want to move from hospital to hospital. Yeah, that will be the first layer of what we give to the patient. After that, what we're going to have in that hospital, it must be translated into activity that resemblance like you are in a holiday resort.
What we have done is we have actually been able to collaborate with Marriott International. So we have officially signed our MOU. Try to facilitate the knowledge transfer from both sides. They will be able to help and train our customers service team. There should be a hotel kind of a service to elevate the expectations on our patients, right? And I'm sure when you're walking into Damansara too, you will see a totally whole new difference. It feels like 6-star hotel, but you are in hospitals.
Damansara 2 is actually our latest edition, right? And as I mentioned, now we are lucky to have Datuk Syed.
So Datuk Syed, being the president of JCorp, Datuk Syed have actually inspired us by saying that how are we able to aspire to be like a Neo of the world, right?
He can see the potential of Damansara 2, the flagship hospital that we can part of.
KPJ Healthcare Berhad is in a journey transformation to become an academic health system. KPJ institution is embracing not just clinical services but also engage in teaching, training, which is education, and research. Research to discover and to innovate and to improve the overall service of patient care.
Your slot is at 9, remember? You know, I hope they have not put in another because we are hard pressed for time. But never mind. Come on. The fact is you have made it. See that? Too young. The MRA will pick it up. It's going to take you about 30 minutes to 45 minutes. I'll see you soon. Take good care. All the best. Bye-bye.
I believe KPJ has those pillars of strength that can really make the institution become a world-class KPJ health system.
But I'm glad KPJ has this very, very strong clinical governance framework. Right? So we have got people who look at risk, safety, quality, ethics, research development, basically every aspect that takes care of the health of the people.
How we're going to deliver the best care to our patient, making some of our flagship hospital to be the national referral center for complex and advanced surgery in Malaysia. What we're going to do is that we want to embed this center of excellence to some of our flagship hospital within the group. At the moment, we're identifying about 12 services, but we're going to start off with 5 disciplines, which is heart and lung, neuro and stroke. We're talking about oncology, we're talking about orthopedic, and not to forget about robotic. That will be the 5 pillars in driving the enabler for our center of excellence for KPJ in the future.
On top of that, we also very, very proudly shared KPJ. In fact, we are the one and the only private hospital in Malaysia providing minimally invasive cardiac surgery. We call it MICS. And how this happens is, without opening up the sternum and the chest, our surgeons be able to provide the bypass procedures to the patients. And imagine there is a huge value in terms of minimizing recovery time. Used to be for weeks or months, and now we bring it down significantly. I think more than about 60% of the time in terms of recovery. Pain level is actually significantly reduced. Imagine you don't need to actually open up your chest in the sternum, and not mention about the opportunity to reduce potential infections. So I think customer satisfaction has been improved tremendously, and we have been having long waiting lists now for patients who come all around the country just to make sure that they do get this best in care, minimally invasive cardiac surgery in our hospitals. So I think just to name a few, those are the latest development which really putting KPJ into a different platform versus others.
JCorp has the visions of Membina and Membela. So this is where it's actually, through its 4 subsidiaries company, they are to make sure that actually they deliver financially, so that they can give back to the community.
Also serve the underserved kind of a community. We have clinic Waqaf,
In KPJ itself, actually we have this Waqaf, clinic Waqaf, static, mobile, and as well as dialysis center, where we run at the very minimal charges so that we can help. So this is how essentially we give back to the community.
Sangat sebabnya dia membantu publik yang kurang bernasib baik dan juga jauh daripada fasiliti hospital untuk mendapatkan treatment yang sama dengan kos yang rendah.
I think KPJ is kind of a bit unique. Generally, patients look at KPJ as a very warm kind of a brand.
Everyone who comes to us, he said, coming to KPJ is like coming to family. He said, and they're very proud to say KPJ is my second home. I wouldn't deny that there are some of our clients or patients, as we call them, they can be very difficult, or they have their own reasons for being difficult. This is where, help listening to them. The most important trait requisite that we all have is to listen. Listen, listen, and listen. We learn the key word here is to adjust. Adjust and try and go with the flow.
Good morning, a warm welcome to KPJ Board Retreat 2024. We're delighted to have all of you here this morning.
Definitely, we are the biggest group hospital in Malaysia. And what we have, where other people don't have, we are available to reach out across Malaysia, from the big city until the small district.
If today is my last day in KPJ, I still want KPJ to be the preferred choice of all Malaysian. I want KPJ to be in the top of their mind. Whenever they think about health needs, they will always come to KPJ.
What I hope for the most for my hospital and for KPJ, I'm sure as a group, is that we continue to do what we are proud of doing and to be proud of what we do. And I think that's really important, because at the end of the day, no matter how difficult it gets, if we can go home feeling like, I've done what I can be proud of, that will keep us going.